I really wish I could make a joke, but this shit isn't funny.
Oh, baby, come on and say it now. Just let the words come out. Tell me you love me.
So I've seen a lot of new accounts and a lot of conversation on Twitter around detransitioning. Detransitioning is a phase that conjures up a lot of feelings because it's dripping with emotion, and it's been used as a weapon by TERFs to scare those who might be questioning their identity into permanently staying away from transition, and likewise to try and make those of us who have transitioned feel like our life is like a glass of bourbon, precariously perched at the edge of a table, just waiting for that one last push to shatter all over the floor. And honestly, what's sadder than spilled booze? So are they right? Are transition folks crawling, walking, and running in droves to their nearest medical center to undo years of work? Are they truly that unhappy? Hardly. That being said, let's dive into the argument if for no other reason than to show people who believe that they may truly need to transition that we don't all regret it. We have issues even defining the debate because there is no clear definition for who has transitioned and who hasn't. There is no clear line. Most of the detransitioning stories you hear involve people for whom the extent of their transition was hormones and therapy, and yet they make it sound like they've all had the full SRS. In reality, most pre-op or non-op individuals who are spotlighted in many of these articles about detransitioning end up reversing their decision. Sadly, in lieu of a more concrete word, we're going to have to live with the gray. So with that in mind, let's examine the myth of the crisis. The most fundamental question of this entire debate is, of course, is there really a detransitioning crisis? Data can be hard to come by in this area, but we do have data points that when taken as a whole create a clearer picture. Anecdotally, for instance, there are very few doctors who perform a reverse SRS in Europe. It's messy, it's complicated, it's dangerous. It's even more dangerous than an SRS. So there's a handful of them that do it, and one of them is a Dr. Mieczysław Jordovic. I'll put it on the screen. But in any case, he's been doing this for 20 years, and he's had a grand total of 14 patients. When we look harder at the research, we find not only are transgender people not detransitioning at a higher rate, they're actually generally happier after transition. There's this oft-misquoted Swedish study. I can hear collective groans. Anyone who is a TERF or a trans person on the internet has seen this study twisted and portrayed in 1,000 different lights. But the authors state in their conclusion, for the purpose of evaluating whether sex reassignment is an effective treatment for gender dysphoria, it is reasonable to compare reported gender dysphoria pre- and post-treatment. Such studies have been conducted either prospectively or retrospectively and suggest that sex reassignment of a transsexual person improves quality of life and gender dysphoria. Now, this study has been misquoted so many times that one of the authors of the study actually had to come out and release a clarifying statement telling people what the study actually means. And that was the impetus of an additional Swedish study, which was completed in 2009, which found that when you look at the trans population post-1989, you find the mental health quality of life of trans women without surgical intervention was significantly lower compared to the general population, while those trans women who received facial feminization surgery, gender reassignment surgery, or both had mental health quality of life scores not significantly different from the general female population. As more recent research emerges, we find that the regret amongst post-op trans folks is rare. In fact, research conducted in 2014 demonstrates that the rate of regret is less than 4%. And that's backed up by numerous other studies, some of which put the rate even lower. A survey in the UK asked both post-operative transgender people and non-transgender people who had undergone cosmetic surgery common among the trans community to rate their regret. These surgeries would include forehead contouring, nose job, jaw contouring. Those non-trans respondents rated their regret at 65%, while the trans community came in with an underwhelming 2%. And yet TERFs don't spend their time harassing people thinking of getting a damn nose job. Surgeries related to transition have an even lower rate of regret than bariatric surgery. You know that weight loss surgery that's supposed to change your life? 6% of those people regret having had the surgery. If you're ever speaking with a gender-critical person about detransitioners, they'll often bring up Elon Anthony. Elon transitioned in 1994 at the age of 19, and for the next 20 years he lived fully as a woman, finally detransitioning at the age of 42. This, on the surface, sounds like a pretty compelling story until you listen to Elon's self-admitted story. He talks about really wanting to transition when he hit puberty because he knew he would be at the bottom of the male social ladder because of his size and stature. Even more alarming, he talks about how he began to have physical issues from overcompensating his movements and that he never felt natural. I think any trans person at the beginning of their transition is going to have an adjustment phase. I lovingly call mine baby trans. I wore a disgusting wig, my voice was way too high because I thought that pitch was the only thing that mattered, and my movements were probably a little overdramatic. But if you're still feeling that way 20 years into your transition, you've probably been misdiagnosed. And in fact, this is a case of someone who clearly thought they needed to transition, but were misdiagnosed, and no one focused on why they felt like they needed to transition. Instead of slapping me in the face with a story every time the argument comes up, why don't we examine it for what it is? It's a clear failure by the medical community to properly diagnose this man. He was given HRT after just 2 sessions, and his psychiatrist reportedly didn't even delve deeper than to ask Elon if he felt like a woman. This isn't a case of the transgender identity falling apart. It's the case of doctors falling apart. It is, of course, undeniable that somewhere around 4% of the population do detransition. I personally know 2 desisters myself, and I'm not trying to erase them. But I think we really need to ask the questions, why are these people detransitioning? How do we support these people? And moreover, how do we better diagnose people in the future so no one has to go through this in the first place? Research shows that society plays an outsized role in the happiness and well-being of transgender individuals. In fact, that scary 40% suicide attempt figure we hear so often is virtually erased when family and friends are accepting and supportive. But family and friends can't be everywhere. The truth of the matter is that despite familial acceptance, the rest of society does exist, and oftentimes they're not supportive. A good article from the sometimes problematic Vice magazine offers an anecdotal look into one person's transition. Chelsea Atonley transitioned from male to female and began the process of detransitioning while she was talking to Vice. She cites society as a major factor in this decision. She even tells Vice that she feels like, God, I can't even look like a woman, I don't feel like a woman, I'm not going to be a woman. Now, she later admitted that she never stopped feeling like a woman, but society's treatment of her because of her appearance was destructive. A trans surgeon named Dr. Harold Reed is also quoted in the article as saying, you can have someone who said they wanted to be a woman and have his genitals removed, but that doesn't make him a woman in society's eyes. The issue of passing is central to trans identity. We're all attempting to transition well enough that we disappear into the crowd, living our lives as our professed gender, unnoticed. But this isn't always possible, and the consequences of that can be severe enough to cause someone to detransition when they really needed transition in the first place. Chelsea eventually restarted her hormones and continued her transition, but society's influence is clear. As I mentioned earlier, I know of 2 desisters, one of whom gave the reason, I just don't make a good woman. I'd rather hate myself than deal with the staring anymore. There are clearly those that are going backward because of misdiagnosis, and there are those who are pushed there by harassment. So by all accounts, the size of detransitioners is small. Despite that, these people are real people. They are suffering. They have real pain. So how do we help? If you ask me, it first starts with maintaining the need for clinical diagnosis before transition. Although this clearly fails at least 4% of the time, I believe it's in part the reason the percentage is so small. Allowing informed consent could open the floodgates to young people suffering from a myriad of other adjustment or psychological disorders, making permanent changes to their body that they might later regret. We also need to do a better job of not ostracizing trans folk. We hear on the news constantly about people being mocked for being transphobic, and if you're in LA or Boston or New York, that's probably true. It's certainly my experience. But in the heartland of this country, people are still dying over their identity. We need to truly accept people for who they are, allowing people to express their gender identity without fear of being mocked or marginalized. That may also have the double benefit for TERFs of showing people that sometimes you truly don't need to transition. People will accept you for who you are. You can live your life without transition. Ultimately, we need to stop scaring people. If you want to share stories of those who have turned back, great. I think it's an important part of the conversation, but don't blow it out of proportion. The path to hell is paved with good intentions, and by positioning these stories as if they're the norm, you may be turning people away from getting the treatment that they actually need. Whether we like it or not, we're in this together. TERF, TRA, True Scum. Ultimately, we just want the same thing for everybody, right? We want everybody to be happy and healthy and safe. So how about we commit to dropping the hyperbole and actually focusing on getting shit done?
What if you were mine? Oh, baby.